The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Whether you're young or old, you may well have asked the question, why am I so tired? Can you relate to that? I'm Dr. David DeRose. Welcome to Wonderfully Made. Today we will be looking at ways to boost your energy level. To help me look at ways that you can increase your sense of vitality and enthusiasm is Dr. Teresa Sherrard as well as Dr. Tim Arnott. It's good to have the privilege of dialoguing with both of you again.
Thank you. It's good to be here.
Now, Teresa, when we speak about problems with fatigue, I mean, most people can relate to this. You, as an internal medicine specialist, what kind of things do you see in your office that really highlight how important this issue is?
Well, I guess I see people that come in fatigued generally have lost the love of living. You know, it sort of drags everything down, and they tend to become depressed because they feel so tired for so long. And it's not just a little fatigue after overworking for a day or working in the garden, they feel a little tired. This is something that's chronic, that's dragging them down day after day after day, and they want to know what to do. Usually people are looking for a quick fix, and sometimes there's not a quick fix, and looking for quick fixes can be dangerous because people tend to go toward caffeine or supplements that kind of boost your energy overnight or short term. But sometimes there are long-term things that we can do that can alter the course of our health that will make us feel more like living. But it's that sort of chronic deadness that people come in, and there are many, 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 many reasons why people feel just dragged down and tired.
Dr. Arnott, let's talk some about that list. If someone comes into your office, they're feeling fatigued, they're feeling tired, what kind of a list do you go down in your mind as far as a diagnosis? What kind of things are you wondering about?
Well, let me cite an example from the Lifestyle Center of America. I had a patient come in who was experiencing a lot of fatigue, a lot of just being tired all the time. And one of the things that we do at the Lifestyle Center of America is to measure a TSH, a thyroid stimulating hormone. And this tells us whether the thyroid gland is acting as it should or whether it's overactive or underactive. And this brings up an important point because, you know, as a medical physician, we have a lot of different tests that we order, and some of these tests have a relatively wide reference range or normal range. Now, this individual had a TSH that was in the upper part of the normal range. And there is some evidence out there, and according to Dr. Robert Iacono, a neurosurgeon in the neuroscience clinic there in Redlands, California, there may be a problem with some of the normal and reference ranges in some of these tests. In other words, there may be some individuals who have some amount of low thyroid, and yet they're in the normal range according to the test. And those individuals, on an individual basis, may benefit from some supplementation of Synthroid or the thyroxine hormone. And so we actually, at the Lifestyle Center of America, try to take each case on an individual basis, but if the individual has an elevated TSH, you may want to consider having your physician bring you to what we consider more of an optimal range between 1 and 2.
Now, so this is really confusing stuff, Tim, because here you're trying to tell us about low thyroid function, and you're measuring a test that's elevated. Teresa, can you make that clear? How would someone have an elevated TSH test and that indicate low thyroid? I mean, usually you think a low test would indicate low function. How would a high test indicate low function?
Well, the TSH is a thyroid stimulating hormone. That means it stimulates, there's a hormone that will stimulate the thyroid, and that hormone is in the brain. And when the thyroid is sort of, we could think of it as being weak or lazy or tired or pooped out, it needs more of the stimulating hormone to get it to go. So you could think of it as ringing the bell and beating it up, saying, wake up, you need to work a little harder. And so when you have to produce more and more of this thyroid stimulating hormone, it means that your thyroid is underactive and that not enough of the hormone is being produced under normal circumstances, and the thyroid stimulating hormone is needed to boost the production of thyroid by the thyroid gland.
So a typical way of checking for low thyroid is to measure this TSH hormone, this pituitary gland hormone that tells the thyroid to work. But Dr. Arnott was sharing with us that sometimes TSH levels may be inaccurate, or we could be fooled by a condition where the thyroid problem actually could stem from a pituitary problem or some other thing that's causing a failure of the TSH to rise. Now this is getting, kind of getting complicated. We're not trying to give you a whole lesson on physiology here today, but suffice it to say, TSH, a simple screening test to check for hypothyroidism. We even use it to check for excess thyroid, but it works in the inverse. If it's a high level for TSH, means the body's yelling at the thyroid, telling it to work harder, means the thyroid is under-functioning. Dr. Arnott, are there any other indications, though, that we could get that someone may be low on thyroid? I mean, what would a person look like who's low on thyroid function?
Well, before I mention that, I would just like to say that in our previous discussion here, the point that I really want to bring out is that if you simply look at the reference range, and if it's in the reference range, you do nothing else and you ignore it and go on, you may miss things. And the human is a very complicated organism, and you may want to be very careful and work closely with your physician and make sure that if you need to be in the lower part of the TSH range, that takes place, and that you don't just ignore what might be a low thyroid even though you have a TSH that's in the normal range. Now, one of the things that can be a tip-off that you may have low thyroid, particularly in an elderly patient, would be something that we saw in my father, but we missed it because we weren't looking for it, and that is when you see these bags under the eyes, this kind of a droopy, saggy tissue under the eyes, and also a receding eyebrow. This is a pathognomonic for a low thyroid, which means you don't see this in any other condition except low thyroid, this receding, this loss of the hair above the eyes. And so that's something you might want to be looking for, but in a younger patient you may not see this. But one of the things that we're noticing is that in this country, as we're carrying excess weight on our frame, we tend to wear out the pancreas, but also we tend to wear out the thyroid gland. And so carrying additional weight can put undue burden, undue stress on these glands, and they can start to wear thin on their function. And so we need to be checking and be very vigilant to make sure that people are not low in their thyroid.
So clearly, patients can come with all kinds of problems that can decrease their energy level. Thyroid problems are one of those. Dr. Sherrard is an internal medicine specialist. You deal with people who have fatigue for other reasons. What other things should we be thinking about if our energy level is low? What else do we need to look for?
Well, also look for the symptoms of diabetes or perhaps insulin resistance. A lot of people that have not been diagnosed with diabetes feel very tired and very fatigued because their cells are not being fed properly, and they could come in. And so that's a symptom of not a feeling of having perhaps a precursor to diabetes or perhaps diabetes itself.
Now, there are other conditions, too, that we think about. Some of the lethal conditions in our society can cause problems with fatigue, whether it's heart disease, cancers. I mean, all of these things have been associated with fatigue. What about one cause of disturbing fatigue that affects hundreds of thousands of Americans, obstructive sleep apnea? This is an underdiagnosed condition. Why don't you sensitize us a little bit more to this issue? How would it look? What kind of problems would a patient be having, and how do we make the diagnosis?
Well, quite simply, if an individual is reported to snore loudly at night, or even to be an occasional snorer. If someone is telling you that you snore at night, and if you have difficulty staying awake during the day, you know, if you fall asleep, if you just sit still in a chair, or if you have difficulty going on longer trips because you fall asleep at the wheel, if you are sleepy during the day and you snore, it's very important to see a physician and make sure that you're not struggling with obstructive sleep apnea. But the good news is that if you lose 10% of your body weight, that is associated with a significant reduction in what we call these apnea, hypopnea episodes during the night.
So apnea technically refers to what? What does that term mean, Dr. Sherrard?
Someone just stops breathing, and when you stop breathing, you stop getting oxygen to your body and especially to your brain. And so people can have these mini episodes where they don't actually wake up, but they stop breathing, and they may jerk a little bit, and someone that's your spouse may notice that you stop breathing and then you jerk and you kind of fall back to sleep, and then you stop breathing and you jerk. Those are episodes where your body is jolted because the level of oxygen has fallen to a critically low level. And so sleep apnea is a very serious condition. It's not something that you could say, oh, I think I'll live with it because it doesn't bother me, I don't mind being sleepy during the day. It can actually cause a lot of cardiac problems from this history of chronic oxygen deprivation over time.
So it's been associated with high blood pressure, it's been associated with diabetes. Probably the most scary thing about obstructive sleep apnea is when those oxygen levels drop in the blood at night, they can trigger an even fatal heart rhythm problem. So although Dr. Arnott has pointed out one of the key strategies for obstructive sleep apnea, which is weight loss, you shouldn't just say, well, I don't need to diagnose this, I'll just lose the weight. If you have the problem, there are easy treatments available. Use those treatments in the short term, and as you're working on making lifestyle changes and losing the weight. What is the most common treatment that is used for obstructive sleep apnea?
Well, there's a treatment called CPAP, continuous positive airway pressure. And what this does is to actually force air into the upper airway, keeping open the airway so that the tissues of the neck do not collapse and cut off the oxygen, the delivery to the lung during the night. I think one of the other things that we need to remember is if you're waking up frequently during the night because of your tissues of the neck are collapsing and you're having these apneic episodes, you're going to miss out on important sleep, which is called REM sleep. And so it's very difficult to remember because REM sleep is the time when during the night the brain transfers what you learned that previous day from short-term memory into long-term memory. And so REM sleep is hampered and hindered by this obstructive sleep apnea, and so memory problems may be an issue as well.
Now there's been research that's even looked at the value of a short nap and how that can improve learning. Dr. Arnott, you've seen some research as well that's looked at just how much difference getting adequate sleep can make as far as encoding, storing memories, and then using those the next day.
That's correct. At the University of Lübeck, there were some German scientists who took healthy young individuals and they taught them a finger tapping sequence. And they were in two groups. In one group, they were able to have a good night's rest after they did this finger tapping sequence, and the other group were deprived of sleep for 8 hours. And then they retested them, and they found that the individuals who were deprived of sleep actually had let me say it this way, the individuals who were able to sleep, they had a 35% faster delivery rate on this finger tapping sequence, and they made 30% fewer errors. Now, other research done by Harvard University researchers and also published in the journal Neuron has showed a similar thing. And in fact, what they did was to teach a piano tapping sequence. And what they did was to have individuals, two groups, learn this piano tapping sequence. One group was tested 12 hours after they learned the sequence. Another group was tested after they had had 8 hours of rest. And the individuals who had the 8 hours of rest actually did better, were more accurate with their finger tapping than those who were tested 12 hours after they learned it. So a night's sleep, a good night's sleep, gives the brain the opportunity to put what you learn today into your long-term memory. And anything that reduces REM sleep, such as alcohol, such as sedative hypnotic drugs, many of these drugs that we use to enhance sleep, to help us fall asleep at night, reduce REM, and they're going to be reducing your ability to put what you hear today, what you see today, into your long-term memory.
Another major cause of fatigue worldwide is anemia. Dr. Sherrard, what kind of, well, first of all, what is anemia, and then what types of anemia are especially common?
Well, anemia means that there's not enough hemoglobin in the red blood cells, and sometimes a smaller number of cells, sometimes a small size of cell. Usually the most common type of anemia is iron-deficient anemia. You don't have enough iron, which is needed to make a good, healthy red blood cell, and so your cells tend to be smaller. And what's generally recommended is that you supplement with iron, but we would recommend generally that you increase foods that have iron, things like molasses and dark leafy green vegetables. Those things tend to have a good source of iron, and we tend to eat those things. Also, if you tend to have anemia or you feel tired, it's also good to check to see if you have any abnormal bleeding of some kind. You never want to just assume that it's an iron problem if you have an anemia. You want to make sure that you're not bleeding for some other reason that could be more serious, like an occult colon cancer, something like that. But the most common reason is iron deficiency, especially in women of childbearing age.
So we're talking here about anemias that under the microscope, when we look at the red blood cells, they're small. Technically, we call these microcytic anemias. There's another group of anemias that are called macrocytic anemias. That means if you look at the red blood cell under the microscope, they have large red blood cells. Dr. Arnott, what would be some of the things that could predispose us to these type of anemias and then fatigue that results from it?
Well, one of the most common reasons for anemia that has large cells is the abuse of alcohol. In fact, alcohol interferes with the use of B vitamin, folic acid, and folic acid is critical for the manufacture of red blood cells. It's important to understand that 1 out of every 4 cells in your body is a red blood cell. So we are full of red blood cells, but yet red blood cells only last 120 days, and then they become old and they have to be recirculated or recycled, I should say. It's also important to understand that in the tip of a pen, a tip of a ballpoint pen, there are 5 million red blood cells. And so this is a huge job for the body to make these red blood cells. And so it's important that we get plenty of folic acid, plenty of vitamin B12, and stay away from alcohol, because all of those things can actually cause this anemia. If you don't get enough folic acid, enough vitamin B12, excessive alcohol, that can lead to this anemia in these large cells.
One of the other tests that I always like to get on a patient who has unexplained fatigue is something called a sedimentation rate. Is that something that either of you like to check, or is that more a unique preference that I have?
I don't check sed rates often with people that just come in with anemia.
No, I don't mean anemia, I mean fatigue.
Fatigue.
You know, we've already checked for anemia or, you know, part of a fatigue evaluation.
No, that's an excellent point, because there are diseases called autoimmune disorders, diseases where the body is actually, the immune system is actually so sensitive that it's attacking your own tissue. It's attacking the tissues of your own self. And these kind of diseases, like lupus and rheumatoid arthritis, can often manifest as their presenting symptom as fatigue. So that's certainly a very good idea.
You know, one of the troubles I have in giving a lecture or talking with patients about fatigue is many times they, you know, come just knowing that they're tired, and if you give a lecture on all these causes of fatigue, they've gone from being concerned they were tired, but, you know, now they think they've got cancer or heart disease, or we didn't talk about chronic obstructive lung disease, or a whole host of other things that can cause fatigue. The reason for giving you this broad picture at the beginning of the program and spending time looking at some of these diagnoses is there are some very critical issues that can cause fatigue. You need to be aware of these possibilities and not just try to self-treat when you're tired. But having said that, as physicians, when we look for causes of fatigue, many times we check for all these major things. We don't find heart disease. We don't find severe lung problems. We don't find thyroid problems. what do we end up coming up with then?
You know, I think, frankly, one of the major causes of fatigue is what we call deconditioning. We don't use our muscles. And the reality is that we are going along through life, and anything that stresses us or that requires a little bit of extra energy, we're unprepared for because we have not conditioned the body. And so exercise program is a critical way to enhance energy level. There's a number of different simple things. I can think of one thing in particular. If you overeat at a meal, I have experienced this, you will actually draw more blood away from your frontal lobe, from your brain, and you'll start to feel tired and fatigued and sleepy. That's a major energy drain. And another thing that can do it are these refined and processed grains, white flour breads and breads that are made out of enriched wheat flour and white rice and some of the chips, the corn chips, things that have what we call a high glycemic index. They can put a burden on your system by increasing the insulin level, increasing the blood sugar, and this can actually lead to a fatigue in the body. And one of the things that you might want to do after a meal, after a particularly large meal, for example, is to get out and walk, because that can help move blood from the lower extremities up into the general circulation. You'll have more blood for the general circulation, including the brain.
So what we're really looking at is after you've had a good evaluation and you haven't been able to identify in conjunction with your physician causes of fatigue that are of a serious nature, we're starting to get into issues that really relate to lifestyle. And the majority of fatigue problems that I've seen in my years of practice as a physician do relate to these lifestyle issues, whether they be diet or deconditioning. Another very important issue when it comes to fatigue are our sleeping habits, the things that surround our nighttime routines. Dr. Sherrard, what are some of the common pitfalls that exist when it comes to getting good quality sleep?
One of the things that I think about first is that we probably just don't get enough hours of sleep. We tend to go to bed at 10, 11, 12 o'clock. We get up at 5, 6 o'clock because we have to go to work. And we're trying to survive on 5 or 6 hours of sleep a night. And many, many people need 8 or 9 hours of good sleep. And actually, we need to be asleep in a certain level of sleep called REM sleep in order to get some of the growth hormones. And so we're probably not getting enough hours of sleep. But other than that, if we're not going to bed early enough, and probably some of the things that are pitfalls is when we're trying to sleep is that we're not on a schedule. Mm-hmm. We need to be on a regular schedule for sleep. If you're having a hard time going to sleep, don't watch the clock, try to get up and do something and actually go back to sleep, but don't lay in the bed and watch the clock every hour. Try to avoid stimulating activity right before you go to sleep, like exercising, doing aerobic exercises or something strenuous and active, jogging 2 or 3 miles right before you go to bed kind of stimulates you, as well as things like caffeine and alcohol. So I would suggest that you do something relaxing, doing stretching exercises that tend to kind of make you prepared to go to sleep. Those are some of the simple things we can do.
How about watching the evening news? Is that relaxing for most people? Or
it really depends. It puts a lot of people asleep, But sometimes the news is depressing or frightening or shows a lot of violent scenes, and we may not want to necessarily watch stimulating television programs right before we go to sleep.
Dr. Arnott, you have some insights, too, on this subject.
Well, when it comes to sleep, I think that one of the most helpful things that we can do is instead of eating a supper meal, to have an herbal tea. Something that's warm, maybe a chamomile, one of the sedating herbs. This can be an important adjunct to a sleep program. And there is no sleep like a sleep where you skip supper and just have that empty stomach all through the night. I mean, that's one of the things that I have found to give me the best quality sleep is an empty stomach when I fall asleep at night. And of course, there's other ways to do it. You can just eat a very early breakfast and space your meals 5 hours apart and have maybe fruit for supper. But I think that light evening meal is critical if we're going to have a good quality sleep. And so I would encourage that. Try it for 2 weeks, or try it even for 3 days. You may be convinced.
You know, it's interesting as we look at this whole theme of fatigue, and we're talking about these, relatively simple things that we can do. I think a lot of times there's a tendency to kind of brush those off to the side, to say, well, that's too simple. I mean, I've had this fatigue problem for weeks and months. The other problem is one that you brought up, Teresa, and that has to do with investing the time in these lifestyle things. Investing the time to spend in bed, sleeping. Mm-hmm. And a lot of people feel they just can't spare the time. But one observation I think is particularly interesting, and that is the research that's showing the linkage between sleep and immune system function. If you're dropping your immune system, knocking it down by failure to get adequate sleep, you're increasing your risk for a whole host of things. Some of those things are things that can decrease your productivity in the short term. You're more likely to get colds and infections. And when you talk about actually decreasing your productivity and not having enough time in your life, I'll tell you, just get a good virus, just get laid up in bed for a week and see how that's helped you. So sometimes these things that take some effort, some expenditure, really pay us dividends in the long run.
No question about it. I mean, if there's one thing that I can point to as immune suppressant, that is sleep loss. And if I want to get a cold or a flu, even though I'm taking my B12 and getting my sunlight and I'm on a good diet without the reprocessed sugars, lose sleep and that virus will take hold of you. But it's important to remember that the same immune system that fights viruses fights cancer as well. So this is a very important topic.
Really what I hear our dialogue focusing around in this program is that yes, there are serious causes of fatigue, but these causes can be identified by proper medical evaluation, diagnosis, and treatment. But there are other areas where fatigue is a result of our lifestyle choices. If someone is having trouble today making changes that maybe God is impressing them to address, but they just seem too big for them to handle, Dr. Sherrard, can you give a few short words of encouragement?
What I would say is to do something simple, take one step at a time. Try not to make too many changes at once, and take something that's problematic and work on that, and ask the Lord to bless that one thing, and He will, and you can take the next step.
Amen. I really love the promise that God never gives us more than we can bear, but He always leaves a way of escape. He always provides an answer. God is not asking you to make changes in your lifestyle that are overwhelming. He's not trying to burden you down with another list of things to do or not to do, but He really wants to give you an abundant life. If you're dealing with fatigue and haven't had a medical evaluation, I'd encourage you to do that. If you've had an evaluation and no one can pin down the cause, pay attention again to these simple, natural lifestyle practices.